Hey, it's Dr. Karen Tang, and today we are talking about tubal ligations, everything you need to know about getting your tubes tied and answering your questions from social media. If you're new to my channel, I'm a board-certified gynecologist and minimally invasive GYN surgeon, and I talk all things reproductive health and sexual health with just a little bit of sass. And so if you haven't already, hit the subscribe button, like, notifications so you don't miss a single bit of information. So the topic of tubal ligations has been really popular in social media for a while now, but especially since the fall of Roe v. Wade. So there are various child-free groups, a subreddit, a Facebook group that have been talking about this and even had surgeon lists of doctors who are willing to do tubals if you are child-free, in your 20s, unmarried, etc., without any judgment. And so, especially since Roe v. Wade, a lot of us gynecologists have seen a massive increase in the number of people coming in to get their tubes tied. So I know people had a lot of questions. I crowdsourced all of your questions on Instagram and TikTok. You had amazing questions, and so we're gonna try and get through as many as we can. So in this video, we are gonna cover what are tubal ligations and how are different ways that we can do them, what are some risks of tubal ligations, the big ones being regret, and also this question of something called post-tubal syndrome. Is it a real thing? And then also questions about practical stuff like cost, how to go about finding a doctor who does tubal ligations. And then the biggest one is what to do if your doctor is not listening to you. This has been a big problem, again, especially for people who are child-free, having to go to many, many different doctors before they'll find someone who will take them seriously. And so stay tuned, we'll cover that at the end of the video. That's probably one of the most important topics, is how do you have that conversation with your doctor, and how do you find a doctor if yours isn't listening? So first off, what are tubal ligations? The whole idea behind tubals is that in order to get pregnant, sperm from sex has to be able to meet an egg from your ovary. And so usually what happens is sperm goes through the vagina, through your uterus, through your tube, and in the tube meets an egg from your ovary. And so if you don't have a tube, they can't meet and you can't get pregnant in theory. And so we try to block the tube in some way, or like I said, basically take the whole tube out. So there's a lot of different ways to do this. The more traditional ways, like literally tying your tubes, meant that, you know, you would take a little bit of the tube, tie it off with suture, and cut off that little part that you tied off. That's literally tying your tubes. There were also little devices that we don't typically use nowadays, clips and rings, where you would literally put a little clip or something on the tube just to scar it off in the middle. We don't typically do that one nowadays because it had a higher failure risk. It's a little bit easier to reverse those type of tubals. We'll talk about that later. But because there's a little bit of a higher failure rate, not many people do the clips and rings nowadays. So usually people are doing the traditional tying it off, which is often what is done at the time of tubal when you have a C-section or you had a vaginal delivery. They do a tubal right through your belly button. Through the C-section, they just do it right through the C-section incision. But if you are getting your tubal when you are not recently pregnant, we do it with something called laparoscopy, and that's my specialty. I have a couple of videos, including a video on how we do a laparoscopic self-injectomy, so search for that. It is a short. I have other videos on laparoscopic surgery, you know, behind the scenes in the OR, so take a look at those to see the whole setup of a laparoscopy. What a laparoscopy is a minimally invasive surgery where we make small incisions in your abdomen. We fill your abdomen with gas so we can see, put a camera in, and we use little electrosurgical instruments to seal and cut the tissue and take out what we need to. So nowadays, most gynecologists will do something called a salpingectomy, which is literally taking out your entire fallopian tube. We do this for a few reasons. One, it has the lowest failure risk because there's no tube left. The other is you actually have a bonus of having lower risk of ovarian cancer. It was discovered through different surgical studies that a lot of ovarian cancers actually come from your fallopian tubes. And so if you take out your tubes, you actually have a lower risk of ovarian cancer. Bonus. No pregnancies, less ovarian cancer. So it's a little bit of a no-brainer. That's why most of us do it these days. Obviously, you can't reverse those since there's no tube left, so that's just something to be aware of. Lowest failure risk, but can't put them back in, so you have to be 1000% sure. Next, the risks of tubal ligations. Tubals are surgeries, and so like every other surgery, there are some risks. And when we do a consult, we always have to run through a long list of possible risks, even though most of the time they don't happen, just so that you're able to make an informed decision. So like any other surgery, risks of infection, bleeding, and blood clots, though overall those risks are very low for tubals. If you are an average risk person, you don't have any other major medical problems that increase those risks. The main risk that's particular to tubals is, you probably guessed it, regret. So there are always some patients who do regret the decision to have a tubal tubal. I actually do tubal reversal surgeries as well, so I do see those patients. Even though it's not a lot of patients, it does seem in studies to be that the younger you are when you have the tubal, in general, the more likely you are to regret it. And so something like up to 20% of people who are young in their 20s at the time of their tubal may regret the decision. So it's not to belabor the point. We always just have to tell people that some people do change their mind, even if they were totally certain at the time of the tubal, just so that you're aware. For most tubals nowadays, like I said, the salpingectomies, because you can't reverse those, you can get pregnant, but you have to do IVF, which is expensive and invasive. So people just have to be aware. The other risk of tubal is that another risk that a lot of you asked about is something that's called post-tubal syndrome. Now, this is actually kind of controversial whether it actually exists or not. It's not something that we as gynecologists typically tell people about because it's not really been shown in studies. So what people say is that sometimes after tubals, they may have experienced, heavier periods, pelvic pain, changes in their cycles, things like that. So what we as gynecologists think probably is going on there is that people were on birth control, which actually lightens your periods, regulates your periods, and decreases pain with periods. And then after you get your tubes tied, you stop the birth control, and then suddenly your periods are kind of terrible and all over the place. So that's sort of my best guess about this. There actually have been some studies looking at this, and it's never been shown to be documented in people who have tubals. There was a big study in the New England Journal where they actually looked through at various other studies and didn't find any evidence that this existed. There's actually a lot of studies on tube removal or salpingectomy in fertility literature because we sometimes will take tubes out to help fertility. If you have a damaged or swollen tube, we'll go in and take it out. That actually helps your fertility. And so they actually very closely studied those patients, checked their hormone levels, ovarian function before and after having your tubes tied, tube removed, and they saw no difference. And I'll just say, in almost 20 years of being a gynecologist and doing a lot of tubals, I have never once had a patient have complaints about anything like this. So, that being said, I never dismiss the possibility that someone might experience things. Just because something doesn't show up in medical studies doesn't mean that it is non-existent, but just that the likelihood seems to be exceedingly low. And it's not something that if you really want your tubes tied and you know that it's right for you, that you should go in there, really worried that that would completely change your mind. So, be aware, some people do seem to report this in the literature and in a lot of kind of experience of gynecologists. We don't seem to think that this is a true phenomenon. Next, other surgical risks. Because we are operating in your abdomen, there are some other small risks, things like injury to the bowel, other organs, blood vessels. So again, that risk is really low, unless you say have had other major, surgeries where you could have scar tissue to your intestines. You are under general anesthesia, and there's always some risks of anesthesia. So again, we have to think about your health in terms of heart, lung, kidney, liver function. This is actually where weight comes in. People ask about, obesity and weight and whether that factors in. It does a little bit for laparoscopic surgery, especially because, and I always have to explain the mechanics of how we do the surgery. When we put a camera into the abdomen, if you were just put a camera in your abdomen, all you see is intestines. Unlike an open surgery or with a big incision, we can't put in retractors to move your intestines away. So we actually tip people head down on the table while you're asleep, and we use gravity to get the intestines out of your pelvis so we can see. So if you are really heavy, or if you have other medical issues, the stress that puts on your heart and lungs is sometimes so much that it is difficult to do the surgery or impossible to do the surgery because the anesthesiologists have to ventilate your lungs, inflate them against pressure. Sometimes if you have a lot of lung disease where we would have difficulty inflating your lungs against all of that stress. So we have to factor in all of those things to think about the safety of the surgery. Again, this is less of an issue a little bit with the C-section tubals, the postpartum tubals at your belly button, because we don't have to do those tricks with the table. But again, this is something where your doctor is taking into consideration your overall medical health and the mechanics of the surgery to counsel you on safety. Finally, in terms of risks, there's always a risk of pregnancy. We never say that something has a 0% chance of pregnancy, no sterilization procedure, because there's always a chance of some sort of a strange ectopic pregnancy where the pregnancy doesn't end up in your uterus. You could have it in, the abdomen, like the muscle of the uterus. So I've even heard of cases where someone had ectopic pregnancies of the vagina after a hysterectomy. There's actually been a few cases of that. That's obviously crazy rare. Almost never does it happen, and I have never had a patient get pregnant after a salpingectomy. So the likelihood of that is really, really low. But even though it sounds crazy, we always have to say there's always a very tiny risk of pregnancy. Obviously, taking your whole tube out is as close to zero as you can possibly get, but we never say anything zero. I will say that there was a little bit of a higher chance of things like pain and painful periods with having your tubes tied with the clips and rings. And we think that's because the tube would spasm as it was dying in that portion. So that did make sense that those patients did have a little bit more in terms of pain and period problems. Next, a lot of you asked about what is the recovery like? So this is, again, a minimally invasive surgery. So usually the recovery is actually a lot faster than people think. So in general, you're going home the same day, exception obviously if you had it during a C-section. But usually you're home the same day. Someone just has to drive you home because you will have been under general anesthesia and a little bit groggy afterwards. So, but you're up and walking the same day. You're going up and down stairs the same day. Usually the limitations on activity tend to be just more like you can feel really tired and you may need to take lots of breaks, take pain medication, usually just high-dose ibuprofen or Tylenol, and people recover a lot faster than they think. I generally will write for up to 2 weeks off of work if you need it. Obviously, some flexibility if your job is really physically strenuous, but we sort of see how everyone does. Most people are back to work within a couple of days to a few weeks. It is something that people can feel very tired and easily wiped out. So I usually tell people, listen to your body. If you're feeling tired or sore, take a break, do what you need to do as you recover. Everyone recovers a little bit differently. One of the most common side effects or complaints immediately after surgery tends to be things like gas, both the gas that we put in to do the surgery and also gas in your colon because your bowels get a little slow after surgery. So a lot of doctors, especially me, will do a lot of counseling about bowel functioning, making sure that you are walking to help encourage gas to pass, giving you things like stool softeners or laxatives to help your bowels to move forward. So a lot of the counseling, weirdly, is about your bowel function after to make sure that you feel nice and comfortable afterwards. And your doctor should be prescribing you all the medication you need or talking to you about what over-the-counter medicines to take in order to make sure you have the most smooth and comfortable recovery possible. Next, covering practical issues, things like cost, insurance, scheduling and consenting, and how to find a doctor. So a lot of you had questions about cost. In the United States, under the Affordable Care Act, all commercial insurances and Medicaid should cover tubal ligations 100% as any type of contraceptive method. So it basically means that you should not have to worry about cost or coverage. Now, there's some nuance to this because every plan is different. There are some HMOs, for instance, that will only cover certain doctors or certain hospitals or cover them at different levels. So you'll need to talk to your insurance carrier and your doctor to ask specifics about cost. But in general, on paper, all insurances should be covering tubal ligations, except unfortunately those who are Catholic or religious institutions which have a religious exemption. So if your employer is, say, a Catholic institution, they may not cover it, but everybody else should. A lot of you also had questions about, is there a minimum age to do tubals? And in general, the main thing is that Medicaid says that the minimum age is 21. A lot of commercial insurances will follow that same rule. Obviously, those of you watching in other countries, there may be a completely different rule depending on the country that you're in. I tend to say 21 just because of the Medicaid rule, and also a lot of things change from your teens to your 20s. Now, most of us will use some nuance with this. Say someone has a medical problem that makes it life-threatening to become pregnant, and they know that they've never been able to safely become pregnant. They know they don't want to become pregnant. A lot of us will use our clinical judgment younger than age 21, but in general, for just elective tubals, 21 typically is it. Does anyone else need to sign your tubal consent? A lot of people mentioned that in certain parts of the country, they were having to have their spouse sign a tubal ligation consent. This actually went both ways. A lot of men said that they had to have their wives sign a vasectomy consent. Just so you know, that's not an actual law or rule anywhere from a medical perspective. That typically is something that that particular practice has as a weird rule. Now, again, if you go to a different practice, most likely you would not have to have have your spouse sign. So this seems to be a very strange regional thing. Again, I'm not sure in other countries if, viewers are gonna say, yeah, actually that's always the case, a spouse always has to sign. But in general, in the US, it's not an actual law. It used to be, back in the 70s, they did have to have spouses sign a consent, but it's not the case anymore. Finally, the big one, what do you do if your doctor is not listening to you and is refusing to do tubal if you want one? So again, at this point, what typically happens at a surgical consult for tubal, your doctor has talked to you about your alternatives, all reversible methods of birth control, vasectomy, barrier contraceptives, has assessed your personal medical risk to see if you're a good candidate for surgery, has talked to you about all of the options, how they do tubal ligations, and at the end should basically say, what are your thoughts? What do you want to do? That's how a surgical consult should always go. You're supposed to hit all of those points. If at the end your doctor's like, nah, I refuse to do this no matter what you want, that's never an ideal situation. In general, the doctor should support you in your decision making. You have reproductive autonomy as long as you're a legal adult and you can consent for yourself. But sometimes there may be just a mismatch between their perspective and yours. This is where, fortunately, you should have the freedom to seek another doctor. Now, again, this may be different in other countries where the medical system is different. But in the US, you should be able to get second, third, fourth opinions until you find a doctor who is meeting you where you're at and helping you to meet your goals. Now, I will say also, not every OBGYN does tubal ligation. So just like nowadays, not every OBGYN is a specialist in endometriosis. In fact, most aren't. Not everyone is a specialist in menopause. It kind of has come to pass that a lot of OBGYNs may not even do surgery. So some of it may just be some of that logistics of finding a doctor near you who does tubal ligations, who is open to the perspective of the patient. So there may be a little bit of searching involved. So this is where some of the child-free lists have come in. In addition to the Reddit, there's also a child-free Facebook group. Paging Dr. Fran, who is one of my friends on TikTok, also collated a list of over 1,000 OBGYNs who are willing to do tubals on people who are child-free, unmarried, in their 20s, etc. So there are some resources to find a doctor near you. You can search by geography on all of those lists for a doctor who will help you out. It doesn't guarantee that they're definitely going to do it. Again, there's some nuances to your medical risks, your insurance, etc. But they should at least be open to having that conversation with you. And like I said, if they say no, they should explain medical reasoning why, not just, oh, I think you're going to change your mind because you're unmarried. That's never okay to say. A lot of people say it. It's not okay to say. But like I said, it should be a conversation giving you medical advice and not just making judgments on your life choices. That's never okay for us to do. So do some homework, look for doctors that people have had good experiences with, who will listen to you and take your concerns seriously. Come into the appointment with perhaps a list of questions and concerns, and make sure before you leave the appointment that your doctor has addressed all of your questions. And like I said, don't be afraid to seek additional opinions if you are not feeling like you have everything that you need in terms of good surgical counseling. I hope that this has been helpful for you. I know we can't have possibly covered every single thing to do with tubal ligations, but this definitely hopefully hit the big points. If you have other questions, drop them in the comments below. If we need to make a follow-up video, we will. Again, check out my other videos on laparoscopic surgery, how we do laparoscopic self-injectomies. Hit the like, subscribe, and notifications so you don't miss any other future videos. And thanks so much. Have a great day. Bye.